How to deal with infertility. Dealing with infertility seems to be affecting nearly every aspect of your life. You're not imagining it and you're not alone. Not getting pregnant can be just as stressful. Depression, stress, and anxiety are quite common and can worsen as the treatment period lengthens. What's more, it doesn't matter why you're not getting pregnant or which partner is the likely cause, the feelings are just as powerful. You probably feel both internal and external pressure to become a parent. Infertility is challenging even to the strongest, bravest, and most supported among us, and unfortunately, our most well-intentioned friends and family can say or do something that pushes us past our emotional limits. The emotional impact of infertility. Before we cover the coping strategies for dealing with infertility, let's take a quick look at the emotional impact of infertility itself. Infertility is a constantly changing roller coaster of emotions. That spike of hopeful optimism when your period doesn't appear exactly on time is followed shortly thereafter by the crushing sadness when it finally does a day or two behind schedule. These constant peaks and valleys can put a strain on your relationship with your partner and friends and your sense of self. Societal expectations. Society gives us the basic lay of the land: date, marry, have kids, etc., and a general timeline. When things get off course, it's easy to feel internal stress and feel your biological clock ticking away. Well-meaning comments from others: when are you going to be parents? Better get trying, and what are you waiting for? Can be tough to hear and even more difficult to respond to when you're already hurting. Partner expectations and relationship strain. Infertility can take a toll on your relationship too. While some couples form an even stronger bond, many others feel the strain of sex on a schedule, disagree on when to seek help and how much information should be shared with others, and finding coping strategies that work for them. Men and women deal with infertility differently. One or both partners may begin to feel that having a child will solve all of their problems or that everything must be put on hold until they bring a baby into the world. Financial strain. Fertility treatment can be costly, particularly over the course of multiple treatments and cycles. If you decide to move forward with IVF, or other fertility treatment, between the cost of medications and procedures, medical bills can be tens of thousands of dollars. This can impact your household finances, and if you have to go into debt to pay for treatment, the debt can be a source of stress for both partners. You may disagree about how to finance your treatment, whether or not to borrow money from friends, family, how much debt is too much, and even whether to start with less aggressive treatment or go straight to IVF. Identify and acknowledge your feelings. Fears. Your emotional response to infertility is seldom the result of just a singular stressor. More than likely, you're experiencing feelings of depression, anxiety, isolation, and loss of control. Take the time to pull apart your web of emotions and think about your feelings and fears. Why are you feeling how you feel? Who are they about? Who are they directed to? By trying to better understand each emotion or fear, you can gain a deeper understanding of yourself. Give yourself permission to cry and be angry. A corollary to coping with infertility. Strategy number 1 mentioned above is giving yourself permission to feel all the feels. Don't turn off your emotions because you find them unpleasant or don't think they're justified. Feel how you feel. Allow yourself the time and space to have a good cry, punch a few pillows, or even scream. Don't blame yourself. Nobody wins in the blame game, whether you're blaming yourself or someone else. In most cases, someone's infertility isn't their fault and is the result of a genetic crapshoot. Accepting that conception isn't going to happen on its own can be very difficult, but blaming yourself or your partner wastes important energy that could be put to better use focusing on the things you can do to achieve your family building goals. Understand your options when coping with infertility. It's easy to feel helpless and not know what you should be doing and who, or if, you should be seeing. It's important to get the facts and understand all of the options available to you. It's important that both partners are evaluated since you play an equal role in the conception process. Once you've had an evaluation, your provider will have the necessary information to recommend fertility treatment options that fit your goals. Practice self-care. If you don't Nobody else is going to give you the time and attention you need to feel your best. Make sure you take the time out from caring for everyone else to spend time on yourself. Go for a walk, read a book, get a massage, or take a relaxing bath, and make sure your eating and sleeping patterns are helping you feel your best. Find healthy outlets, hobbies, and pastimes. Re-establish intimacy with your partner. Be realistic, but highly optimistic. It can be quite a challenge to remain upbeat and positive while enduring month after month of disappointment, but couples dealing with infertility need to remember to look at the stars just with a good dose of reality. Setting realistic goals can be helpful. These can be something as basic as changing what you eat, getting more rest, or trying acupuncture. These are achievable milestones, and small successes set the stage for bigger ones. Start with basic lifestyle changes like diet, supplements, exercise, and then expand from there. Small victories along the way will give you a boost and help you stay positive in the long haul. Join an infertility support group. Feeling understood and supported while dealing with infertility can help couples cope, particularly when the support comes from people who have experienced their own fertility struggles. The success stories of others can also be inspiring and help keep you positive about your own journey.